Welcome to DBC Diaries, episode 30. Today you're going to see returning patient, Kat. She was here last year. She did our 100 million IV treatment in the facial. She came with her husband who did some treatments also, and we'll do a separate video with that. Today we'll focus on Kat's treatment. So she came back this time to focus on an area that she's had issues with in the past. She had a spinal fusion in her cervical spine, which is the neck area, many years ago. I think it was around 4 years ago. And it worked. She still has a bit of pain and tightness here and there, but she's kind of at a point now where she feels like it's starting to have some issues. So we did an MRI, we took a look at it, and sure enough, just around where the fusion is, she's starting to have some issues. So she opted to do our neck treatment, and that's what you're gonna see here. We've been helping so many people with our back treatments, either in the neck, cervical spine, or the lower back lumbar spine, or even in the middle, the thoracic spine. In her case, it was fused. We can't change anything with a fusion. That's mechanical, but there's always scar tissue left over from these types of surgeries, and the stem cells do a great job at getting rid of scar tissue and helping the discs above and below the fusion. So that's what we're doing here. You're gonna see what it's like to be a patient here at Dream Body Clinic. Stay tuned. It's DBC Diaries, episode 30. DBC Diaries Day 1. So today, Kat and her husband Greg are arriving. Our drivers meet them in the airport and then get them to their hotel. It's a real easy process. The airport can be a bit crazy sometimes. Just know, keep your head down, go to the information booth, and our driver will be waiting there.
En este momento vamos por Kat, que se encuentra afortunadamente a unas cuadras de aquí de la clínica y aún así se le brinda el servicio.
DBC Diaries Day 2. Today, we start with blood work and MRIs. We always ask that patients arrive fasted for blood work, meaning no food or drinks after midnight the night before and water only in the morning. This ensures we get accurate results. So we start with checking weight with blood pressure and then take the blood draw. And then after that, if MRIs are appropriate or needed, as it is in the case of Kat, we start with the MRIs. We've got our own MRI machine here on site. So we do that all here in-house. We get the same results the same day from the radiologist and the images, and that gets us ready for the next day. DBC Diaries Day 3. So today is consultation and payment. We only do the consultations when patients have scans such as MRIs, ultrasounds, x-rays, and these sort of things. We want to make sure that the patient is a good candidate. So with Kat, we were looking at her blood work. The doctor goes line by line, making sure that everything's in order and that she understands where her health is at. And then we go image by image through the MRI so she knows exactly what's going on. Fortunately, in her case, the doctors deemed her a good candidate and we proceed with treatment. So when this is done, we go up to the admin office, we take care of payment, and then the next day we'll be ready for treatment.
El día de mañana nos acompañará la paciente Kat y en este cuarto se realizará el tratamiento de cervical, además de su IV y el facial.
DBC Diaries Day 4. Today is treatment day. So it's a very simple procedure. We typically start by taking a blood sample to spin up and use for PRP that we mix with the mesenchymal stem cells. We do that, and then treatment is 4 easy injections around the most affected discs and area. They are intramuscular, and these will get to inflammation. They will help rehydrate the discs at night. So if there's any herniated discs, we can help regenerate those discs back to the normal size and shape. The stem cells will help get rid of any scar tissue in the area, which can lead to the healing of the underlying tissue. They can help with the facet joints. If they're starting to close because of arthritis, we can regenerate the cartilage there and regenerate any nerves or nerve damage in the area, as well as in the spinal cord. If there's any nerve damage there, the stem cells will send out neurotrophic factors to guide that healing process. So that's that. And then after, we sit down in our treatment room for the IV. Very simple. We start with the IV. And this is where you'll see me and Kat talking about her previous treatment and how things are going today.
So today we're going to do the facial treatment to Catherine. In this treatment, first I'm going to mix the PRP with the stem cells. I'm going to put in the whole face with an injection. After that, I'm going to use the Mesojet machine. So this machine is without needles. This use electroporation that help to open the canals of the skin, and so the PRP can be inside the skin.
All right, welcome to DBC Diaries, episode 30. I'm Josh, and I'm here with returning patients, Kathy, Greg. Thanks for coming back. And right now, I guess we're going to talk with you, Kathy. Like, what's been going on? It's been, how long has it been? Almost like a year since you were here last?
It's been like exactly a year, pretty much, yeah.
Nice. Well, great. Well, how's everything been going? I think last time we did an IV like you're doing right now, right? Mm-hmm. We did, the facial treatment also?
Facial and IV, yeah. I felt so energized after the IV. It was like, wow, I'm not an early riser and I could get up early. I felt really energized. I think that lasted maybe for like 6 months or something like that. You know, okay. I was telling my husband I wish I could come every 6 months, but no, I felt really, really good, and my face looked really good. And you know, because I didn't want to go get more fillers and things like that. So got it. I feel like it's a good time to come back and get that. I hear you have a new piece of equipment that instead of all the needling, I get something a little more comfortable.
Well, we're still going to do the insulin needle injections, right? Like we did last time.
Right.
That gets them deeper. We want to get them down to the collagen, to the fat, to regenerate those tissues. But on the superficial level for the skin, we used to do the microneedling. That's a good way to get cells in, but like you're also puncturing, and it's not like a normal needle where it's administering while it goes. It's just sort of forcing it in.
Okay.
This new device is needle-free, and it uses, I believe it's called like electroparalysis, where it's almost opening up the pores and then forcing the cells in. So we're not damaging the cells, we're not damaging the skin.
Oh, nice.
And that gets that in there. And it's a pretty new device. I believe they started them maybe in Russia or something is where it all developed.
Oh, wow.
And yeah, we've got 2 of them. They're really new equipment, but it's pretty cool. I did it like 2 weeks ago.
Oh.
And I guess it feels like the light, I can't even call it a shock, but you can tell there's like some electricity going. It's very easy, doesn't hurt at all. So yeah, you could experience
that.
Well,
your skin is glowing, Josh.
Thanks.
You always look so healthy every time we come. Oh my God, yeah.
Well, I mean, that's the good part of being preventative with the IVs. There's so many anti-aging benefits. Even the IV helps skin tone.
Right.
And then you hit it deeper with the facial. I mean, that is the ultimate anti-aging combo from what I've seen. People getting, you know, we've had patients do the DNA like methylation tests or finding their epigenetic age is younger. We're seeing people, I mean, look, you got more energy there for a while. We'll get you some more now. Not everybody gets a boost of energy from it. That's the strange thing. Like for me, I almost get a bit lethargic for a few days, and then I feel like I have more energy, but everybody's a bit different like that. So it just depends.
We were a little tired after. Like I remember we went back and just kind of rested.
Yeah.
But we were, good to go the next day. So
Excellent.
So then the other reason I'm here is for my neck. I had a fusion in my neck, 3 vertebrae, C3, 4, and 5 in 2020.
Okay.
So, but I was pretty good for a couple of years, but then more and more I'm getting radiating pain down this side of my body, and not so much in the back of my neck. It's more here, and then the edge of my shoulder. And so, we're gonna you're gonna apply some stem cells on either side. You showed me the x-rays. I can see bulging discs on the discs that are underneath.
Yeah.
And I've always heard that. I did hear that is a risk with fusion.
Yeah.
But I was losing sensation and a bunch of stuff, so I had to do something fast. And it was affecting me. So I'm looking forward to that. I feel better because I thought it was going to be intrathecal, and it's not. It's going to be muscular, so that's good. I feel better about that.
Yeah, it's a very easy treatment. It's just 4 shots there. I did it a couple years ago, and then my mom was just here like in May, and she had a fusion probably like 3 or 4 years ago in her lumbar spine.
Okay.
She had like weird polyps forming, and she just did the IV at first. That was enough to kind of get her back playing tennis and stuff. And then she finally, just like you, it starts developing herniated discs either above or below. And hers, since it's lower, I believe it was slightly above, and yours, since it's neck, it's slightly below. It's just, those are stuck, so the other ones have to take the brunt of the force.
Right.
And that's the good part with the treatment. We're consistently getting results back where we're actually rehydrating those discs, because that's what the cells are going to do.
Okay.
At night, what you should do, and I'll send you some info on this, there's different stretches and protocols at night, because when you lay down, you're decompressing the spine. So you just naturally, you wake up slightly taller than when you went to bed. It's kind of crazy, but that's because the discs are rehydrating because the vertebrae are decompressed. And that's when they start working to rehydrate. But if you don't have enough mesenchymal stem cells there to guide that process, it doesn't always happen. So we found that by putting them in that way, we actually get better results than even in the past we went into the disc. And that was a really invasive procedure. We had to go to the OR. It's like, it looks like a harpoon. This thing they're putting in there, and they got to use like fluoroscopy to get it. It was very invasive, very expensive because of all the extra costs. And we didn't get better results from it. We've actually seen much better by doing this because they're working from the outside in.
Okay.
Mesenchymal stem cells, they don't turn into other types of cells in your body. They work via the paracrine effect, so it's the signals they send out. So you want them on the outside helping that rehydration process. And we should be able to increase your disc height, hopefully get those herniated discs normal, which will relieve pressure on the spinal cord. Yeah. And then any of that numbness can hopefully go away. And they also help regenerate the nerves, even in the spinal cord. So it's very effective, and I can't wait to see how you're doing here in a few months.
Yeah, I know, me too. Yeah.
Great.
So that's why we're here, and we're getting our
also for the snacks.
For the snacks. Yes, for the snacks.
You gotta have some snacks, All right. Well, good. Well, we'll keep that going then.
But we always tell everybody about our experience here.
Yeah?
Yeah, I always tell everybody. Yeah.
Well, thank you.
Yeah.
I mean, I feel that way. It's like you tell other people if you had a good experience. It's just, why wouldn't you want to share that? So that's why we do these videos. We want people to see what's the experience like.
Right.
People worry, hey, it's Mexico, but I mean, I'm sure you've seen how safe and nice it is. So.
Oh, this is a beautiful clinic.
Thanks.
Very beautiful clinic. I feel very safe here.
And Puerto Vallarta is very safe.
And I know you guys treat a lot of sports players too, so right?
Yeah,
so
definitely.
People that are athletes, so.
Yeah, probably the worst neck I've ever seen was like professional trophy truck drivers, because that suspension doesn't always like soften.
Really?
And you want to see a bad back. Some of those guys, it's pretty impressive how bad that can mess them up. But we've been able to fix them, so it's been good.
Wow. Well, I feel good, and I'm looking forward to next year what I'm going to do.
Yeah, well, thank you. And a lot of people do that. It's like you don't have to come back, but the anti-aging benefits. It's being preventative. I found is so important. So helps a lot of people.
Well, I mean, because I think we've done a lot of research and reading. Greg, especially, he's the one that started it all about how as you get older, you're not making as many of those cells. So why not help that? It seems like a no-brainer.
Yeah, I mean, it's tissue that gets thrown away otherwise. It's such a waste.
Yep.
And
I specialize in no-brainers.
well, she said you could read. I was like, whoa.
Thank God for computer technology. I don't actually read anymore.
Yeah,
It reads
just
for me.
voice to speak. Perfect. Well, cool. Well, Kathy, thanks so much for sharing. Thanks for
sure.
watching at home. And if you've got questions, you want to learn more about stem cells, feel free to contact us at www.dreambody.clinic. You can call us toll free at 833-445-9089. I'm Josh. Happy to help. DBC Diaries Day 5. So the purpose of DBC Diaries is to showcase patients who attend to our clinic for more stem cell treatments or maybe medicine such as growth hormone and such, so you understand the process. The main point here really is so that you can see these patients' testimonials. It's amazing the kind of results we're seeing across the board for so many different types of treatments, and we love showcasing that, showing it to you, and helping more people. So if you'd like to learn more about stem cell therapies, about our legal fly-and-buy program for different medications, get a hold of us. You can call us toll-free at 888-704-3977, or you can go to the website at www.dreambody.clinic. I'm Josh, happy to help.